everyone. I'm Rebecca Weber. This is your AMAC podcast, Better for America. Today we have a special show. Joining me now is Carl Hohsfield. He is AMAC's Vice President of AMAC's Medicare Advisory Service. There's a lot of information that you're going to want to hear from Carl, so stay tuned. We've got a great show coming for you.
The Association of Mature American Citizens is the conservative voice for Americans 50 and older. AMAC is fighting for the values that you hold dear. Join today. Together, we can write the course of America.
Carl, this is really great. I am thrilled about the services that you've built to provide extraordinary advice to over 2 million AMAC members, and that is AMAC's Medicare Advisory Service. Carl, share a little bit of information with our members how it all works. If somebody is turning 65, nearing 65, what can you do and your great team of professionals do to help each of our members?
Sure. We have dedicated licensed agents waiting to help every member in every state. Our goal is to help a member find the most suitable plan that suits their needs, their individual needs. So it's really important to us to not steer anyone into one plan or one company. We have multiple options. We have multiple insurance carriers that we can look at in all the markets, competitive rates in every state and every area. And unlike AARP, who has one option, that's United Healthcare, we have multiple options. And so our agents are trained and advised to do one thing, and that's listen to the customer, understand their needs, and help them find the right plan that's right for them, that suits their budgetary needs and that suits their medical needs, and that in the end, they can walk away comfortable and satisfied with their choice.
Now, AEP is the annual election period. That begins October 15th and runs through December 7th. But there are some common myths, and we try to really make things clear to AMAC members and educate them on what that annual election period really is and what it means. I'm going to run through those top 5 myths, Carl. I'm going to ask for you to straighten it out for our listeners. So here we go. Myth number 1. Your Medicare supplement plan can only be changed one time a year, and that's during that annual election period. Carl, that is a myth, correct?
That's correct. That's a myth. We're talking about Medicare supplement or Medigap plans. Very different than Medicare Advantage. Your Medicare supplement plan, you can review and shop outside of your initial open enrollment period, which starts 6 months from your Part B effective date. After that, depending on the state you live in and different eligibility rights, you can switch that plan and speak to an agent about plans in your area and shop your plan and see if the price is right for you every year if you'd like, multiple times a year if you'd like. But if you're comfortable, you could stay on it for a couple of years and then work with your agent and switch again. But the point is, we highly suggest that you work with us to determine, am I on the right plan and am I on a competitive plan in my market that I live in?
You can change your Medicare supplement plan at any time, subject to guidelines. That's why it's important that you speak with an agent before you make any changes. Excellent. Myth number 2, a Medicare supplement plan and a Medicare Advantage plan are virtually the same thing.
These words and phrases and acronyms get thrown around very easily. Medicare Advantage plan is also referred to as Part C. Sometimes people use the acronym an MA or an MAPD. But the point is, here's the key differences, and they are very different. A Medicare supplement, also known as a Medigap plan, is a private health plan sold by a private insurance carrier, run by that state's Department of Insurance. It comes in the form of plan letters, like Plan G as in George or Plan F as in Frank, not to be confused with Medicare Parts A, B, C, and D. But a Medicare supplement plan is exactly what it sounds like. It supplements or fills in the gaps of what original Medicare Parts A and B does not cover. So for example, Medicare Supplement Plan G covers everything except for the Part B deductible that Medicare doesn't cover for Medicare covered services. You have no networks, so you can see any doctor that accepts Medicare in any state in the country. It typically comes with a monthly premium. It does not include prescription drug coverage, so somebody who enrolls into a Medigap plan can then choose their own separate Part D plan that suits their needs. And a big key again, no networks. You can see any doctor that accepts Medicare. On the other side of the fence, you have Medicare Advantage or Part C, also sold by a private insurance company, often lower or zero premium, but it comes in a network form like an HMO or a PPO typically. It means you have to see doctors in that insurance company's network, in that Medicare Advantage plan's network. If it's an HMO, you can only see doctors in that network. If it's a PPO, typically you can go outside the network but pay higher cost share. And unlike a Medicare supplement plan, you have out-of-pocket expenses like copays, coinsurances, and shared dollar amounts for a variety of Medicare covered services. So those are the key differences: is out-of-pocket costs, networks, and kind of freedom. Now, most Medicare Advantage plans include drug coverage, so that's a benefit to an Advantage plan. But a benefit to a beneficiary on a Medicare supplement plan is you can choose whatever drug plan you would like and see any doctor that you would like.
A Medicare Advantage plan, which is Part C, often comes with lower premiums, sometimes a zero monthly premium. However, you do have to work with a network, whereas a Medicare supplement plan will offer a wider network. Perhaps if you're traveling, you may need that Medicare supplement plan, but may come with a higher premium. That higher premium oftentimes will save you your out-of-pocket costs and deductibles and copayments. Is that right?
That's very good, Rebecca. And think of it this way: if anyone's ever been on an employer plan or a under 65 health insurance plan, you typically have deductibles and copays for things like urgent care, emergency room, doctor visits. That's similar to how a Medicare Advantage plan works. Whereas a Medicare supplement plan, as I say, I'll use this example. Plan G, as in George, covers everything that Parts A and B does not, except for the annual Part B deductible. What that basically means is every time you go to the doctor, every time you need service of some sort, you're not taking out your wallet and using your credit card and paying out-of-pocket copays for all those different services. We also don't steer anybody into one plan or the other. And nobody can tell you that one plan is better than another. The truth is, there's a right plan for each individual person's needs, and that's what our goal is.
And that's what I love about what our people right here, people who work right here in the AMAC building, who are talking to AMAC members each and every day, is they're custom building a plan that meets that individual's needs. And that's so important. Let me move on to myth number 3. Myth number 3, my prescription drug plan is automatically covered in my Medicare supplement plan.
Medicare supplement plans do not include Medicare Part D. That's the drug coverage. So if somebody's on a Medigap plan or a Medicare supplement, they have the option to choose a standalone prescription drug plan, even if it's a different insurance company than what their Medicare supplement plan is with. So they have a little more freedom there, whereas a Medicare Advantage plan typically includes drug coverage. Very different, again, in the way the plans work.
Myth number 4, Carl, we hear this one a lot. I just turned 65. I'm still working full time and I'm covered by my employer. Therefore, I must terminate my employer coverage and enroll in Medicare Parts A and B and buy a Medicare health plan.
Thank you for bringing up this common myth, and we get hundreds and hundreds of calls a month on this very, very topic. Rebecca, as we know, many Americans are working past the age 65 more than ever now. Maybe it's 66, 67, 70 years old. If you are on a credible insurance plan, when you turn 65 and you want to remain on that plan because you have the option to, you do not have to enroll into Medicare Part B. You're typically going to be automatically enrolled into Medicare Part A. Medicare Part A will typically coordinate with your group-sponsored plan. And we advise, if it's a credible plan and you want to stay on your employer plan, do not enroll into Part B because that comes with an additional Part B premium, monthly premium, and you'll be paying that along with whatever you're paying on your group health plan. And unfortunately, we come across people who are advised poorly every day, who were told at some point in the past you have to get B. And sometimes, they're pressed into this decision without analyzing it properly. And therefore, when they do retire at 70 years old, they've paid 5 years of Part B premiums when they didn't have to. So it's very, very important that we tell people you're not on your own. Talk to us about it and we'll guide you through what the right decision is. And we'll educate you to help you make the right decision. We won't make it for you. We'll make it together.
I love it. And I think it's important that people who are maybe 6 months or 3 months before their 65th birthday, give us a call. Even if you are still working, we can ensure that you are making the right choices and not paying added premiums if it's absolutely not necessary. So that's a great point, Carl. Thank you. And finally, we come to myth number 5. Myth number 5, I can drop my Medicare Advantage plan or enroll in a Medicare Advantage plan at any time.
That is a myth. Medicare Advantage plans are governed by the eligibility rights of Medicare Advantage and the way Part C works with Medicare. So therefore, we have what's coming up on our calendar. That's the annual election period. The annual election period allows anybody who's currently enrolled into a Medicare Advantage plan or not enrolled into a Medicare Advantage plan who is enrolled into Medicare Part A and B between October 15th and December 7th, they can make a choice, see what plans are available in their service area, and make a change to their plan, keep their plan, or drop their plan and go back to original Medicare. Those are the choices they have for Medicare Advantage and prescription drug plans during that annual election period, October 15th to December 7th. Other than certain special enrollment periods, like somebody moving out of a planned service area to a new service area. Give you an example. If somebody moves from New York to Florida, they're going to automatically lose their Medicare Advantage plan in New York, and they'll have to look to a new plan in Florida. But that would be a special enrollment period. Outside of those SEPs, we call them, special enrollment periods, you cannot switch your Medicare Advantage plan whenever you like. That's what the annual election period is for. And these plans are guaranteed for 1 calendar year at a time, January 1st to December 31st.
Excellent. So that's what this annual election period is all about. It's really about assessing where you currently are, determining if you need or are eligible or want a Medicare Advantage plan. It's the time of year when you look at your prescription drug plan, determine if you need to change your prescription drug plan. And of course, we are here for you 24/7, so to speak. If you don't get a licensed representative, they will get your message. You'll be put in touch with a dedicated agent who will be your go-to person for all things Medicare, not just the day that you enroll, but in years to come. And that is a service that I think is unmatched, Carl.
That's right. Thank you. We think we're the best at what we do in the industry, and we really hope that you give us a call so we can help you, because that's our only concern, is to point you in the right direction, navigate your way through what can be a confusing Medicare space, and help you make the right decision in the end.
Thank you so much, Carl. And for everyone listening, be sure to check out myamacmedicare.com, myamacmedicare.com, or go right to the amac.us website, and you'll find our AMAC Medicare benefit tile right there on the homepage. We've got people at the ready. The phones are ringing. Give us a call. Let us show you how we can help you. Thank you all so much for listening today. I'm Rebecca Weber. Have a wonderful day, everyone.
There's a concerted effort to intimidate and censor conservative thinkers. The very freedoms secured by our Constitution are being threatened by the most liberal progressives America has ever seen. It seems like everything they do is to the detriment of our great nation. But there are plenty of patriots with the courage to stand up to the left. Join AMAC. AMAC is a voice for conservatives that cannot be ignored. Stand with over 2 million America-loving patriots by joining AMAC today.